Okay,
Yes, we can.
awesome. Hi, everyone. My name is Sue Ropski. I'm a registered nurse with the West Idaho School District. I've actually been a nurse for about 40 years. I worked for 18 years in Chicago. I worked as ICU, CCU, and hospital administration. Then when moving to Idaho, had a bunch of small children of my own and opted to work in health prevention instead of hospital-based medicine and moved into school nursing. And I have worked for the West Idaho School District since 2001. And so today we're going to talk about overdoses and severe allergies. As far as my background, you can see I have a master's degree in nursing. I have a master's in public administration focusing on hospital administration. So that is my background. Next slide, please. So I just need to make a little adjustment here so I can see my slides. Okay, so our learning objectives for today is first, we're going to review the school nurse's role in identifying and managing anaphylaxis in the school setting. And then we're going to be moving into overdoses, focusing on opioid overdoses, and then just understanding when and how to administer naloxone. So pretty straightforward learning objectives today. Next slide. Thank you. Life-threatening allergies. When we look at the data from the Allergy and Asthma Network, they have some great statistics. About 1 in 12 children have food allergies. 29% of kids with food allergies also have asthma. When we look at the reactions we do have in our schools, about 25% of those reactions are to students or staff without a previous diagnosis of allergies of any kind. You can see the fatalities across the bottom, and then also the number of people with latex allergies. So allergies are something that we all deal with. A typical classroom will have a couple of students in there with a food allergy. And we know that allergies in the school setting, for kids with food allergies, we typically have our health plans in place for those students. And we have trainings that we've done so our staff are ready and know how to respond. But keep in mind, 25% of those life-threatening allergic reactions we're going to be having with people that had no idea they had that problem. So we need to be prepared to deal with both situations. Next slide, please. So this poster I love. We have it in every single health office in the West Idaho School District because it is a quick reference guide, anaphylaxis at a glance. And the allergens that can set off anaphylaxis, we all know well. I won't read through them. It seems like allergens have been growing over the last 10 to 20 years. I do have quite a number of kids in my school with EpiPens. The other thing I love about this poster is it really is a nice visual for the common symptoms from mouth, throat, heart, lungs, skin, really looking at the multi-system response you can have. And so by having a resource like this in your office, if someone comes in and you need something, it's always there hanging on the wall if you feel like you need a review, or if someone's covering your office that may need a review. What I love most about this is the big red star. An epinephrine auto-injector is the first line of treatment to stop the progression of anaphylaxis. And I like to say, like, epi first, epi fast, because when our next slide comes up and we go through the plan, I always want to remind people, go back one more slide. I want to remind you that Benadryl will not solve our problem. Oftentimes people are hesitant to give the epinephrine. They feel like it's more invasive. But keep in mind that Benadryl is an antihistamine, and Benadryl, if your student or staff member is having an anaphylactic reaction, is not going to stop the anaphylaxis. So use epinephrine immediately is something that when I'm training my health techs or possibly working with my secretary or my admin in the office, I emphasize that. Okay, next slide. Thank you. I wanted to point out that students with food allergies, and I'm sure our dietitian can validate this, they are protected by the federal civil rights legislation called the American with Disabilities Act. And so if a student has a documented food allergy through the American Disability Act, they are eligible for free case-specific dietary substitutions. And so this is the meal accommodation due to medical condition form. It does need to be signed and filled out by a state-allowed healthcare provider, typically the physician, and they give us written documentation for what we can substitute. And then typically your dietitian at your school gets this information and will follow through with whatever substitutes can be made. Next slide, please. So every state can have different regulations or statutes regarding epinephrine. So I think all of us are from Idaho. And so in the state of Idaho, we as a school can be given permission by our school boards to provide an epinephrine auto-injector to a student to self-administer with a prescription from their provider. And so at West Ada, we do have a permission form that parents would sign saying that their child can self-carry their auto-injector. At the elementary level, per our policy, we request that a physician or healthcare provider signs off that the student is actually able to use their and be able to self-administer their epinephrine. When a student comes in that is self-carrying, I always bring them down to my office and we'll drill, and I'll say, okay, let's just pretend whatever their allergen is. Show me how you would do this, and we walk through step by step what to do. Oftentimes, students really have it down. Sometimes students have no clue. And so then it's really up to us to continue that education process. One of the things I always educate parents on is if the epi auto injector is in my office, I have it in an emergency kit ready to go. Sometimes kids, and I'm working in a middle school primarily now, they just don't always quite know where that epi auto injector is, and it may be in their backpack or it may be in their gym bag, but we all know that when we need it, we need it. The other is to be able to administer an auto injector to a student that we are injecting the auto injector instead of self-administer. And then finally, I wanted to bring attention to 5B, that the governing authority of the school that participates with epinephrine auto injectors need to have detailed standards for training that are completed by school personnel. And so how you do that at your school, how we do it in the fall is we have a back to school training. All of our licensed staff get trained. All of our health techs are trained each semester, as well as our office staff. So for me, I typically train a secretary and a principal in case I am not in the building at the time. And the training that the Idaho statute says needs to be done is how to recognize the symptoms, the standards on how to use it, and then emergency follow-up procedures. And one of the things that we always include in our emergency follow-up, of course, after we call 911, stabilize the student, transport, because if you're using epi, you should always be calling 911. Epi doesn't always solve our problem, but epi buys us time to get additional medical assistance to our school through EMS, because oftentimes additional epinephrine will be needed. But then always take the time to debrief with your team at school. It can be kind of scary to a lot of people when stuff like this happens at school. And so really taking that time as the medical leader in your building to process with your staff what happened, what you did well, what maybe you could do better next time is an important part of that follow-up. Next slide, please. Okay, so I love the American Academy of Pediatrics Allergy and Anaphylaxis Emergency Plan. Any student with severe food allergies will have an individualized health plan or an emergency health plan, whatever you call it in your district. As the school nurse, it's critical that I identify the school staff who are predominantly working with that student. In our district, we try to have a healthcare person in the building at all times. So I will typically train 2 people in my front office. The only time I would really train a teacher is if they were going on a field trip. But even then, when we send students with EpiPens on field trips, they either are with their classroom teacher or their parent. They cannot be assigned to another parent or another class. They have to either be with their classroom teacher who has been trained in carrying the EpiPen as an unlicensed care provider, or with their parent that obviously would be carrying the EpiPen. And once again, I can't emphasize enough for those severe allergy and anaphylaxis symptoms. And if you look here, this is why I love the form. It's very simple. It's very cut and dry. You read through for severe allergy and anaphylaxis, what to look for. You read through the list. If it's on the list, you give the epi. For the mild allergic reactions, what to look for, and it walks you through. At the beginning of the school year, I go through this with my parents. I have them sign it off. Best practice would be to get a physician's signature. I won't lie, sometimes that's hard to do. So if I have the EpiPen comes to me in the box from the pharmacy. That's my doctor's order. I know a physician or a healthcare provider has ordered that, and with the parent's signature and the medication consent, we're good to go. There is that one box in the middle that says special situation. If that box is checked, it means that the provider or physician has said, if this child is exposed to X, give the epi, even if it's mild symptoms. And sometimes when that box is checked, the times that I've used epi, the student has shown no symptoms, but we don't have time to go into the cases now, but in the watching the students' course of reaction, I mean, giving it probably saved their life. So if that special such situation box is checked, please pay attention to it if this form is what you're using. You don't have a form you like, this is a really good one, easy to use and very clear. Next slide. Okay, so the most important thing is that you know and follow your district policies and procedures. And we're not going to go through the West Data ones. These are my policies and procedures that I will be judged by if a student is having an anaphylactic reaction. So it's important that you know your procedures for your district. And if you are interested in West Data's, there they are for you to refer to. Next slide. So in our schools, we have standing orders for EpiPens. So when we administer a medication at school, we administer one of 2 ways. We either have a valid prescription in the name of a student, comes to us from the parent in the bottle or the box, and that label is our valid prescription in the name of the student. The other way we administer medications at schools, we have a standing written order from a medical provider to treat a life-threatening emergency. So we have a standing written order in our district that we can use epinephrine if we suspect that someone's having a life-threatening anaphylaxis. And this red bag is the exact same bag in every single health office through our district, and it is set up exactly the same in every single office in our district. So in that unzipped bag on the right, I just took out this little pencil pouch, and you can see my epinephrine is in there. The other thing that you can't see also in that side is where I keep my Narcan. So if I'm in any office out of all the schools in our district, there is this exact same red bag set up exactly the same, and in the exact same zipper is where I can find my emergency medications. So if I get pulled to another school, I know exactly where to look. We've talked about documenting training. I heard a little bit at Snowy, they may have some hands-on training this summer, so I'll be looking forward to hearing if that will be available. The other thing we need to talk about is storage. You have to store your emergency meds out of the reach of students, yet they need to be unlocked and readily available. So really think about in your office where you're going to put these. In West Ada, if it is EpiPen, it is stored in an orange pencil pouch, and in that orange pencil pouch is a copy of the student's emergency health plan, their emergency medications, parent contacts. It's all right in that zipper bag. So if someone has an orange zipper bag district-wide, you know there's going to be an EpiPen inside, either EpiPen Junior for those that weigh under 66 pounds, or an EpiPen for those over 66. Okay, next slide. So, should we ban allergen foods from the classrooms? So, my take on this is no. And the reason is because number one, we really have no idea. If we hang a sign up like this, that it's a peanut-free zone, we have no idea what's coming to school in kids' backpacks. And so we really are giving parents and teachers a false sense of security when we say somewhere is a peanut-free zone. It also doesn't teach kids how to navigate a world with their allergens. So unless a child never goes into the community, if they're going to play at the park and the grocery store and the library, none of those places are peanut-free zones. So in our district, we do not hang any signs like this. As far as field trips, when we have field trips coming up, we have a big one coming up to the Philharmonic. We talk with each parent about if there will be any food on the field trip or not. We send the orange pencil pouch with either the parent or the teacher, and they will carry the meds, have the medical information, and they always have a cell phone. One thing to always think about, because we live in Idaho and not everywhere is within cell phone range, if your field trip is outside of cell phone range, you need to have a way to get EMS if you need it. And of course, we learned that the hard way one time when we went on a trip a little bit outside of cell phone range and found the cell phone didn't work. So always just think about that on your field trips. Next slide. So what would you do? Here's a student with a severe allergy to peanuts. Oops, they ate an egg roll during her break prior to after school soccer practice. They get to soccer, they have a tight sensation in their throat, it's making it hard to breathe. You listen to their lungs, they're wheezing, they're scratching, you see some swelling starting, their vital signs. You can see the blood pressure, heart rate's up, O2 sats are dropping. What's the most important step to take? Hopefully all of you are typing in the chat, administer epinephrine and call 911. Because that is a perfect example. And then obviously we stay with that student. We don't leave them alone. We call our admin down for assistance. We send someone to meet the paramedics to come find us in the building. We contact parents and basically follow your emergency procedure. So next slide, please. This is a real life example of a student in the West Ada School District. She was 13 years old and she was out of school cheer banquet for her cheerleading club. She didn't know that baklava had nuts in it, ate some baklava, had an anaphylactic reaction, which obviously was emergency, and passed away a few days later. So it's important that we spread knowledge about food allergies. Free Strong is a local organization that does that. Also, the Food Allergy Research and Education, or FAIR, they have amazing resources available. The American Academy of Pediatrics, NASN, there's a lot of really great resources out there I encourage you to use. Next slide, please. Okay, we're going to move into opioids right now. And then at the end, if there's any questions, I'll take those. So we all know what opioids are. They're strong medications used to treat chronic or short-term pain, or they're illegal medications like heroin. If we look at the stats in Idaho in 2022, we had 270 deaths related to opioids. 49% of those involved fentanyl. And we had 755 emergency department visits related to overdoses. Sadly, unintentional drug overdoses have jumped for kids aged 10 to 19, 109% between 2019 and 2021 in the United States. The American Medical Association is really leading the way, supporting widespread access to opioid overdose reversal drugs, otherwise known as Narcan. So we need to try to work to support them and to support Narcan in our community and in our schools. Next slide, please. So what's the NASN say about that? The National Association of School Nurses has a position statement on naloxone in the school setting. And basically it states that safe and effective management of opioid-related overdoses have got to be in our emergency plan. And we all have our crisis plans that we work on with our schools. And this is a critical element according to our national organization. We know that emergencies can happen, including drug-related emergencies. And so to be trained and have proper management and a plan in place is what is really important to have a positive outcome for the individuals. So hopefully school nurses across the state are working to get naloxone or Narcan for quick response in their emergency kits in their school settings. And that would be in line with the National Association of School Nurses. Next slide, please. So here we are, here's our Narcan. It comes in multiple routes. Most of us have the pre-packaged nasal spray in our offices. And it's very simple. You put it up, you push, and it goes right in it. It is just sprayed in one nostril. If it doesn't work right away, 2 to 3 minutes later, you can give it in the other nostril. That box will have 2 doses in it. Sometimes 2 doses is not enough, but hopefully 2 doses will buy us enough time for EMS to get to your building, and EMS will have additional Narcan available if needed. Next slide. So you are coming up to a suspected overdose. You're coming up to somebody, they're on the ground, we don't know what's wrong. What are you going to do? You really need to look at your patient and look for the signs of an overdose. And here they are. And we all know them. The slow breathing, it's shallow. They could be a little blue. They're unresponsive, or sometimes they're kind of in and out of responsiveness. Sometimes they're just really high and you're kind of watching them, trying to figure out what's going on. Pinpoint pupils, are a big one. Pulse that's very weak, slow, or absent. And so what you're going to do is you're going to shout at this person, you know, remember like in CPR, Annie, are you okay? You can rub across their lips. You can rub across their chest, and not a sweet little nice rub. You know, you are trying to wake this person up. So really shout loudly. If you suspect that the person is not going to respond to you, you're going to want to call for help because we need more help than we have the ability to give in a school office. And oftentimes these people are not coming in your office. You're going to get a call that someone's down in the cafeteria or on the playground or in a hallway, that someone found someone. So you want to be sure someone's calling 911 and that someone's going to meet 911 because our campuses are often very big. And if 911 shows up and doesn't know where to go, they're not going to be much help to us. If you have an AED, quickly get it. And when I tell someone to get my AED, I look at them and I say, you know, whatever their name is, you go get the AED. It is located in the front office behind the secretary's chair. Because if I just yell, go get the AED, and they don't, as a teacher, maybe they don't know where the AED is, they could be running around looking and not be bringing me my equipment I need. So I always tell them exactly where it is. Next slide, please. So we're going to give our Narcan. And once again, it's very simple. Hold it up, push the plunger. If the person doesn't respond in 2 to 3 minutes, we're going to give our second dose, alternating nostrils for the most absorption. And then we know that people who have overdosed on opioids die because they're not breathing. So we're gonna, you know, go into our CPR, do our rescue breaths or CPR, depending on the status of your patient. If someone is doing CPR, you can give naloxone simultaneously. They don't have to stop their CPR if they're doing compressions or something. You can go ahead and give it. Next slide. So, sorry, there's a bell ringing. Hopefully it will stop in a minute. So if symptoms return or the person doesn't respond, we're re-giving our Narcan. We talked about that. Okay, so at this point, we're getting the person to the emergency department as quick as possible. Even if they revive and say they're fine, which sometimes they do. Sometimes they revive and they'll say things like, why did you save me? Or they'll say, I'm not going. It's really a non-negotiable if it's a drug overdose, because we know that they may be talking now, but they may not be talking in a few minutes. So after the student or staff or whoever you found is transported, this is once again the time to document and debrief with your staff. It's pretty scary for everybody when this happens. So really provide, as the medical person, sometimes people want to get busy and get right back to work. Take the time before the day is out to pull a group together to discuss the process and experience. Next slide, please. So once again, know and follow your district policies and procedures. That's how you will be judged. This is my policy and procedure. This is what I follow. Next slide, please. So here's a real life example of what something could look like. During the school day, you're called to the scene, a 17-year-old unresponsive in the gym. They're unresponsive. They've got kind of that snoring breathing. Their pulse is 45, kind of thready and weak. Their eyes are pinpoint. Their skin is clammy, a little bit of cyanosis. You see an empty, unmarked pill bottle at the scene, but there's also a powdery white substance inside the hood. What are we gonna do? Hopefully everyone is typing. Get your emergency kit, administer your Narcan. If you do not have Narcan in your school, then you need to be getting EMS to your building ASAP, because without that medication, this person's life is definitely could be at risk. Next slide. So I love the saying, we may not be able to stop bad decisions, but we may be able to stop bad outcomes. And that's one of the key points with overdose. You need to be able to recognize the signs, and we read through those already. You need to be able to give a quick response with your naloxone. You always, always, always call 911 if you administer naloxone. Next slide, please. The last key point with severe allergies is know the sign, which we've read through, and know that this is a systemic allergic reaction, and it can be associated with many systems in the body. And so oftentimes the saying, if it's more than skin, stick it in. Epi first, epi fast, adrenaline is what we need. So we need our EpiPens. If you inject your EpiPen and you're not seeing improvement after 5 minutes, oftentimes you will have your second EpiPen you can use. We've talked about do not substitute Benadryl and antihistamine for epinephrine, which is the critical life-saving drug. And the other thing I encourage you to do is run practice drills with your teams. We have like some flashcards we use in Lost Data that you can go up and give somebody a flashcard and it's like, here's the situation, what are you going to do? Just because it is important to be able to have your team know exactly what to do in a situation like this, because time is of the essence. I think that's my last slide, Lindsay. Just the references. So there you go. Are there any questions?
Wonderful. Thank you so much, Sue. So again, please don't hesitate to use that raise hand feature to make sure we can unmute and you can ask Sue your questions, or you can use the chat.
Sue, I was curious about how often you do those drills for students. Oh, sorry, Noreen, you raised your hand, but I love that idea of, kind of preparing the students, especially the ones who might have accidentally left their EpiPen in their gym bag or locker. How often are you doing that?
So with the students, definitely at the beginning of each year, I'll assess their knowledge to see, do they know their plan? Do they know what to do? Are they able to tell me what they're allergic to? Do they know to ask about unknown foods? Just kind of go through the health plan, identify the areas needed for education. And then when I see the students throughout the course of working in a school, I'll just look at them sometimes and be like, do you know where your EpiPen is? And sometimes, it's like, no, I left it at home. And so in situations like that, I will call parents and just say, I know you want them to self-carry. Would you consider leaving a second EpiPen at school that I could keep in my office? Now, the cost of EpiPens, well, we could have a whole program just on that. So for some people, it's not realistic. I do have my emergency EpiPens in my red bag, but once again, I'm a registered nurse. I can do the assessment. I'm licensed to give that. My unlicensed assisted personnel have to follow the plans. And so that epi is not really available as kind of backup epi. As far as staff, I try to do a drill with my office staff at least once a semester. Sometimes the drill is like the real actual event, and then we can kind of use that as our drill. But if things are going well and all is quiet, I'll just go out and be like, hey, let's just pretend this is happening right now. What would you do? Just to be sure everyone knows their part. Thank you for that good question. Is there any other questions?
Take it away, Noreen.
Yes, I didn't have a question. I just wanted to say thank you, Sue. Yeah, and I love how you're emphasizing trainings, because trainings are what make it less scary when it actually happens. You can go more into just automatic mode, because with both of these situations, you've got minutes. You don't have 20 minutes or 30 minutes or an hour. You usually have minutes. And so, hesitation. That's why we love Benadryl. Oh, let's just give this and see how it goes, because we're scared to give EpiPen, or we're scared to do Narcan. But you guys are mainly medical personnel. You know that there are Good Samaritan laws. If you give Narcan and it wasn't necessary, there is no harm at all. If you give EpiPen and it wasn't maybe necessary, in retrospect, it's also still okay. They'll have, fast heart rate. They'll be a little bit jazzed, but again, no harm. And so it's better to just do it and then realize, oh, we didn't need to do that. You should actually pat yourself on the back, because you want to overgive it versus undergive. So that was the only point I was going to make, and you did a good job emphasizing that.
Thanks, Dr. Womack. I guess the other thing, I know we have nurses from many different areas in the state here. Please know, we've used Narcan and we have used epinephrine in our schools, in our district. So if your school that does not have Narcan, you may want to have a conversation with whoever it is in your district that's making those decisions, because it truly saves lives. And I think everyone here would be in consensus with that, don't you, Dr. Womack?
Yeah, I went to Walgreens and I bought some Narcan for my car, just because there's so many and increasing numbers of overdoses, mainly fentanyl. And I don't remember how much it was. It was 40 something, 50, somebody could look it up really quickly, but it wasn't much. But, just having it available makes me feel better, because if you see somebody who looks like they're passed out and they're too young to be having a heart attack or a stroke, and they're not having a seizure, they're not breathing very well, so they're kind of bluish, the chances are Narcan will save that person's life.
The other person that probably is carrying Narcan would be your SRO. So if you have a SRO in the building and you're a nurse without Narcan, you may want to check with your SRO and see if they're carrying some. But it's very rare that we have SROs in our building all day available to us that quickly. So, but that might be another person. I see a hand up.
Thanks,
Thank
Leanne.
you. It's Leanne. I was just wondering, you talked about your emergency epinephrine, like your stock epi, and I wonder, you'd mentioned that you as a licensed nurse is authorized to administer that medication, but can you speak to like the Idaho statute, the 33520A, that talks about having stock epinephrines in school, and maybe what kind of education program you might have in place for staff so that they are eligible to administer that even though they're unlicensed?
So I don't have that statute memorized, so I can't comment to that statute. I would have to read it. I can tell you that as a staff nurse, it's my job to follow my district policy, protocol, and procedure. So I may have input into that, but I am not the end all when it comes to developing that. So in my practice, those are the banks of the river for me. I have to practice within the guidelines of my district. Now, if the statute is saying that the banks of my river need to be wider, then that's something we'll have to look at as a district. And I definitely can go back and look at that. And if we are not meeting that statute, certainly we would examine that. And as far as training, the emergency medical kit, that red kit, is the medication in there is for licensed nurses to use. So that is not medication that if a teacher thought their student was having anaphylaxis, they could run down and just do that. Now, if you're telling me the statute reads something different, then we'll probably need to review that statute. But I thought we were within the banks of the river. We definitely train everyone that needs to know. We train them each semester. And so that is our procedure. But once again, your district's procedure may be a little bit different. And as long as you're practicing within the scope of your district, you should be okay. Does that help? But I will go back and read that.